Obamacare has done a lot to expand access to healthcare. It removed the ability to discriminate based on pre-existing conditions, gives subsidies to low-income families to buy insurance, and allows young people to stay on their parents' insurance until they turn 26. It also required that all states expand Medicaid to more low-income Americans. But in 2012, that requirement was struck down as unconstitutional, and the expansion was made optional, leaving 4 million Americans without Medicaid who would otherwise have it.
Fans of Obamacare like to point out that more than 26 million people got coverage through the law, but a majority got covered through expanded state Medicaid programs which cover low-income Americans.
Medicaid expansion.
Georgia refused to expand Medicaid.
The expansion of Medicaid is tremendously important to 184,000 West Virginians.
What the law does is it says to states, expand Medicaid.
Before Obamacare, states were only obligated to give Medicaid to poor children and poor pregnant women up to 138% of the federal poverty line. The federal poverty line represents the lowest income needed for basic necessities. It is $12,880 per year for an individual and $26,500 a year for a family of 4. Obamacare required that all states expand Medicaid to Americans living under 138% of the federal poverty line. Since it was deemed unconstitutional, 12 states have decided not to expand Medicaid. Let's use Texas as an example of a state that has not expanded Medicaid. In Texas, children are eligible for Medicaid at different income levels depending on their age. The Children's Health Insurance Program gives extra coverage so all children under 206% of the federal poverty line can get Medicaid or the Children's Health Insurance Program. Pregnant women can get Medicaid up to 203% of the federal poverty line. Seniors and the disabled can get Medicaid up to 74% of the poverty line. Parents can get Medicaid up to 17% of the poverty line, but individuals who are not disabled and do not have children cannot access Medicaid in Texas. The reason behind the Medicaid expansion in Obamacare was that people living below 138% of the poverty line would get free or low-cost healthcare from Medicaid, and people living above the poverty line would get government subsidies to pay for private insurance. People living here are eligible for both federal subsidies and Medicaid, but can only choose one. The subsidies gradually phase out, and when someone reaches 400% of the poverty line, they get no subsidies. But not all states expanded Medicaid, and as a result, there has been created a gap in coverage, where people earn too much to get Medicaid, but don't make enough to get government subsidies. These people are ineligible for subsidies to buy private insurance because they are supposed to get Medicaid. This is known as the Medicaid Coverage Gap. For example, a childless Texan making $5,000 a year will pay more for health insurance than a Texan making $50,000 a year, because the person over here will get subsidies while the person over here won't get subsidies or Medicaid. Expanding Medicaid is linked to fewer uninsured people, better affordability, and overall better health. In 2019, states that had expanded Medicaid had nearly half the amount of uninsured people compared to states that had not expanded Medicaid. The Kaiser Family Foundation, a non-profit that focuses on health policy in the US, looked at more than 400 studies of the Medicaid expansion, and most studies found that it had a positive effect in a wide range of areas. They also found that most studies found a positive effect on accessibility, utilization, and affordability of care in states that expanded Medicaid. The Kaiser Family Foundation estimates that 2.2 million uninsured adults in non-expansion states live in the Medicaid Coverage Gap. Another 1.8 million uninsured adults who currently live here between 100 and 138% of the poverty line are eligible for government subsidies but would be eligible for Medicaid if their state decided to expand it, which would probably give them a more affordable option. In Texas, almost 1.5 million uninsured adults would become eligible for Medicaid if the state decided to expand it. Under Obamacare, the federal government will pay 90% of the cost of expanding Medicaid, and the states will only have to pay 10%. According to a study from September 2020, Texas government would receive $5.4 billion in federal funding and would need to pay $600 million themselves if they decided to expand Medicaid. But that study did not look at what a Medicaid expansion would do for the wider Texas economy and how it might affect tax revenue that could offset the $600 million Texas government would have to pay. According to the Kaiser Family Foundation, the 20 studies that looked at the wider economic effects of Medicaid expansion all found that the expansion had a positive effect on the state economy. So you might wonder, why haven't Texas and the other 11 states expanded Medicaid and closed the Medicaid coverage gap? The simple answer is politics. Most of the states are conservative Republican states who do not want to touch the expansion because it is associated with Obamacare and Obama, who is a very disliked figure among Republican voters. It seems unlikely that the states are going to expand Medicaid on their own, so what can Biden and Democrats in Congress do about the Medicaid gap? The answer is, they're working on it. Under the COVID relief bill, all states that expand Medicaid will get 5% more federal funding for their entire Medicaid program for the next 2 years. According to the Center on Budget and Policy Priorities, the increased federal funds would exceed the full cost of the Medicaid expansion. The Biden administration hopes that this will incentivize states to expand Medicaid, but if it doesn't, they might turn to Biden's other proposal and enroll all Americans who don't have Medicaid because their state has not expanded it in Biden's proposed public option. But in a narrowly divided Senate and House, this second plan might not be able to pass. Thank you for watching, and we hope to see you another time.